Hello, welcome. My name is Sophie Hughes, and I'm going to talk about the early results of an impact evaluation pilot at Health Technology Wales. I'll start with a bit of background about who we are. Health Technology Wales is a national body working to improve the quality of care in Wales. We were convened in November 2017, funded by Welsh Government and hosted within NHS Wales, but are independent of both. We produce guidance for Welsh health and social care based on the clinical and cost-effectiveness evidence for health technologies. From the outset, Health Technology Wales were committed to embedding impact evaluation in our work. Health Technology Wales work with an external evaluation organisation called Matter of Focus, with whom we developed our evaluation framework using their specifically developed software called OutNav. The Matter of Focus approach is based on contribution analysis, an approach which acknowledges that change within complex systems is not driven by cause and effect. Our evaluation framework consists of a series of outcome maps for each of our three key remit areas, which are to support the identification, appraisal, and adoption of health technologies to improve the quality of health and care in Wales. As an example, this is the appraisal map, which shows the relevant output, so that's what we do and who with, against which we collect process data, followed by how they feel, what they learn and gain, what they do differently, and what difference we ultimately hope that this makes. We collect data on impact to populate each stepping stone of the outcome maps. It also allows us to flag gaps where we might not be achieving the impact we'd hoped. Here I will present the results of an early analysis of data collected since implementing this framework. For this analysis, the impact data comes from three sources. Firstly, we designed a Health Technology Wales impact survey to help us populate our outcome maps. As you can see, it asks questions which align with each column of our evaluation map and comprises mainly free text boxes, but is also supplemented with some multiple choice questions. By starting with a question on what would you like to give feedback on today, we are able to attribute stakeholder feedback to specific aspects of our work. For this analysis, we retrospectively piloted this with key individuals who had been involved in our work. The second prospectively collected source of data was the Access Our Guidance web form. As part of Health Technology Wales's evaluation strategy, we included this form on our website when it launched in November 2018. When website users click to view Health Technology Wales guidance, this form pops up and asks them for some identifying information, which allows us to categorize the data by stakeholder type. None of the fields are compulsory, and if preferred, the user can select to skip and continue to download, which is a limitation of this data source. Lastly, we analysed informal feedback, which may include word of mouth or feedback received via email, for example. So starting with what we do, we aim to respond to the needs of healthcare providers, service users, and technology developers across Wales. This includes the proactive identification of upcoming technologies that may have a major impact on Wales. Anyone can suggest a topic to us to appraise through a simple online form on our website. Since our inception in 2017, over 200 topics have been proposed to Health Technology Wales, and we've produced topic exploration reports for most of these. You can see here that in 2020, topics came to us mostly from NHS Wales, but also from industry and Welsh Government. So ideally, we would want to collect data on impact from these stakeholders. The other large part of what we do is appraise. Our evidence appraisal reports include input from experts in the respective field, and they are used by our multidisciplinary groups to produce Health Technology Wales guidance. All the impact evidence captured to date relates to Health Technology Wales's identification and appraisal functions, No feedback has been captured to date for Health Technology Wales' work to support adoption, though it is a really important part of our remit to monitor the uptake of non-medicine technology guidance across Wales. Here you can see the categories of stakeholders who responded to both our impact survey on the left and our Access Our Guidance web form on the right. Health Technology Wales received feedback from a wide range of stakeholders, including policymakers, healthcare professionals, industry representatives, HTA agencies, and patient organisations. We are also able to attribute this feedback to different areas of our work, which will allow us to make targeted improvements in response to feedback. For example, under our Identify map, we received formal feedback on our topic exploration reports from a healthcare professional and an academic. We received feedback from an industry representative on our horizon scanning activities and another for our scientific advice service. For our appraisal work, we have evidence from a range of stakeholders, including commissioners, HTA organisations, healthcare professionals, members of the public, industry representatives, and research organisations. There are clear gaps. For instance, in this early analysis, we haven't received any feedback from social care professionals. Again, it's by doing this kind of analysis that we're able to address these gaps in the future. In general, impact survey participants said Health Technology Wales products were useful, which is great to hear. People reported that they liked having a trusted source of guidance based on robust processes. A scientific advice service user reported that it's fantastic to see that we tick the right boxes. And a patient organisation noted that the recommendations will be of interest to people with MS who contact us. In addition, some respondents provided useful suggestions for how to improve our processes, such as one respondent who suggested we could improve our topic exploration reports by adding bullet points which explain the key messages and what they may mean in practice. The next two columns in the contribution analysis are what they do differently and what difference has it made. Stakeholders have reported using Health Technology Wales products to inform their work, including commissioning decisions and policy papers, working with patients, education and research. Such as this member of the HTA body in yellow who said, "We plan to increase adaptation for NHS Scotland." And this commissioner who said, "We are able to use the output to inform commissioning decisions." Clearly, this is very early and limited data, as we only have 2 respondents to our impact survey for the impact of our topic exploration reports. For our guidance, the impact appears to be mixed. We're able to break this down a little as we included a free text box to ask what difference it made in the wider health and social care context. We discovered that some frustrations were noted around guidance implementation. For example, this health professional said, "I think the process is good, but needs some support from the Welsh health system to support the recommendations." Clearly, there's a lot that we can learn from these data. Undertaking a pilot of our impact evaluation strategy in this way has allowed us to take stock of what we've achieved so far and streamline existing structures for data collection. For example, it's also highlighted things that we can improve, such as adding "I don't know" options across the board in our impact survey. And it's highlighted issues that we'll need to consider going forwards, such as taking a decision on how soon stakeholders should be contacted after publication of our guidance in order to detect an impact, and whether this should be regular contact, and if so, how long should we follow up with that stakeholder? There are several limitations to the pilot analysis, such as possible duplications in the data set when people access guidance more than once. The Health Technology Wales Impact Questionnaire has to date been sent to individuals specifically identified by us and has not been disseminated more widely, which could result in bias. Reporting of informal feedback may not have been consistent across all staff members, which is something that we're working on. The next step for us is to embed impact evaluation into our business as usual work. Then we'll be able to consider expanding our methods for data capture, such as conducting stakeholder interviews. It's also important that we use the data, both by reporting our impact and using the data to drive improvements. We've already come some way towards this. Health Technology Wales evaluation evidence is used to inform various published Health Technology Wales outputs, including annual reports and case studies, and it's also included within our regular reporting to Welsh Government. In terms of using the data to drive improvements, we also took some of the feedback we received during this pilot into account when developing our strategic plan. In summary, the results of our impact evaluation pilot have given us an early signal as to the usefulness and impact of the work across our programme and can be used to drive improvements. Thank you for listening. I'd also like to thank everyone at Health Technology Wales, particularly those who work on impact, Lauren Elston and Susan Miles, as well as Matter of Focus. Thank you everyone for your time.